Good day, everyone. I am Alyssa Beatrice Pabalinas, and together with me are Carl Justin Montiague, Francine Panisto, Lloyd Placido, and Alexandra Jeanette Sellado. We are the Group 4A from DN3D, and we will present our research titled The Lived Experience of Student Nurses Navigating Post-Psychiatric Nursing Exposure. One of the most crucial experiences in nursing education is clinical learning, where student nurses encounter the humanistic side of the profession and employ their knowledge from the theoretical aspect of nursing. Clinical practice contributes to nearly half of the educational exposure for students pursuing Bachelor of Science in Nursing. It is essential to evaluate nursing students' experiences during their clinical exposure to psychiatric health nursing, as nursing education develops to prepare them for a variety of healthcare situations. Our study aimed to explore the lived experience of student nurses navigating post-psychiatric nursing exposure.
The research utilized a qualitative research design employing a phenomenological approach. The participants of this study were 7 Level 4 nursing students of the University of St. LaSalle who were selected purposely based on the inclusion criteria: male or female, age between 21 to 23 years, bona fide Level 4 student of university for school year 2023 and 2024, with 1 month of psychiatric nursing exposure and have participated in the direct care of a patient with a mental health condition.
A researcher-made interview guide was used for the data collection through face-to-face interviews. A comprehensive data gathering procedure was employed to capture the depth and variety of experiences of the fourth-year student nurses, followed by a thorough data analysis using Collise's 7-step thematic analysis. The researchers strictly adhered to the appropriate ethical considerations. Informed consent was given to the participants before the interview. The privacy and anonymity of the interviewee's profile were guaranteed by safeguarding all the recordings and by giving them respective pseudonyms.
The results of the study revealed 3 main themes. Theme 1, challenges during psychiatric nursing exposure. Theme 2, coping strategies. And Theme 3, personal and professional development. For Theme 1, challenges during psychiatric nursing exposure. It outlines the various challenges encountered by the nursing students during their psychiatric nursing exposure. Psychiatric nursing is a specialized field of nursing that can be emotionally taxing as well as rewarding, according to nursing graduates as well as students. For sub-theme 1A, we have fear and anxiety. This sub-theme talks about the variety of situations that could potentially cause anxiety and fear in the students. These situations include fear of making mistakes, failing, not knowing enough, having a bad experience with their preceptors, feeling uncomfortable when interacting with patients and their families, and not knowing how to act. For the sub-theme 1B, we have stigma and discrimination. Elaborates on existing stigma that student nurses have encountered during their exposure. The participants revealed that the negative outlook on individuals with mental health conditions, thinking that the patients are violent, angry, and dangerous, is one of the challenges that they encountered.
Poor patient facilities. The atmosphere within a mental health facility is crucial to a patient's care, while it is one of the areas of health care that receives the least attention. Inadequate milieu management in mental health facilities has an impact on the social milieu and eventually the mental health of the patients. The participants revealed that while some facilities have provided good quality of care through their services, some facilities did not have a conducive environment for them and their patients. Conducting therapeutic communication. Effective therapeutic communication can help alleviate patient anxiety, build trust, and facilitate understanding between the nurse and patient, ultimately leading to improved patient satisfaction and quicker recovery times. However, some student nurses encountered difficulties in maintaining therapeutic communication with psychiatric patients since there were patients who were unpredictable and could not maintain a conversation well.
For the Theme 2, coping strategies. This theme elaborates on the coping strategies that the student nurses employed to deal with the difficult and stressful situations brought by their first exposure to psychiatric nursing. Sub-theme 2A, personal preparedness, can be linked to psychological resilience, which can be defined as the ability to maintain one's existential goals amid stress. This sub-theme represents a holistic way of thinking that is characterized by perseverance and self-awareness. allowing people to overcome life's challenges while maintaining goals for personal development. Subtheme 2B, social support, the development of coping strategies for student nurses were also influenced by the clinical instructors or institution support during their psychiatric nursing exposure. Students agreed that the clinical instructor's way of supervision plays an important role in students' feelings of being supported. It concluded that clinical educators should use a caring approach to support and improve nursing students' clinical skills.
Lastly, for Team 3, personal and professional development. Personal development is enhancing any ability one wishes to improve for self-improvement. Whatever the particular skill, the key to personal development is knowing how to take the right actions to reach one's objectives. Results show that exposure to psychiatric nursing was a significant event that led to the personal and professional development of student nurses, preparing them for the future profession. Subteam 3A, enhanced skills and knowledge. Early on in their clinical practice as psychiatric nurses, these students struggled with emotional ups and downs, which is understandable given the emotional demanding nature of the occupation. But as their therapeutic practice developed, they changed, growing both personally and professionally as a result of adjusting to the challenges and creating coping mechanisms. Subteam 3B, affirmative outlook on psychiatric nursing and mental health conditions. The results show that psychiatric nursing exposure affected the attitudes of students toward mental diseases, their perceptions of psychiatric nursing, and their decisions about their careers.
In conclusion, it is already recognized that the psychiatric field of nursing is one of the most difficult fields in the program, as it focuses on caring for patients with mental health disorders, involving emotional support, medication administration, and therapeutic interventions. This challenging field requires competent and reliable nurses. Despite its importance, psychiatric nursing is often perceived negatively by the students due to the complexities of mental health conditions. Student nurses' exposure to psychiatric nursing provides valuable insights into mental health, though experiences can be both negative and positive. This study explored the lived experiences of student nurses navigating post-psychiatric nursing exposure, identifying challenges, coping strategies, and personal and professional growth. Themes include fear, anxiety, stigma, communication difficulties, and the importance of social support and preparedness. The findings align with Peplau's interpersonal relations theory and Roy's adaptation model, emphasizing the significance of nurse-patient relationships and adaptive responses. This study informs improvements in practice, education, and support for psychiatric nurses and patients, guiding curriculum and policy development. Here are the references for our study. Thank you so much for listening.